Hey everybody, we're going to talk a little bit more about the indications, or put simply, what we can treat with Lyftogt Prolotherapy. Now, Lyftogt Prolotherapy may be used in many conditions. If you think about it, we're reducing that nerve action potential ability. So we're stopping nociceptive feedback from getting to the brain, which we then experience as pain. Now today I've broken that down into four main areas: neuropathic pain, chronic musculoskeletal pain, sports injuries, and then resistant cases. So let's go into a bit more depth on each of these. Now, neuropathic pain, that's what we're talking about here. We're reducing what's going to be going to the brain as nociceptive feedback and then experienced as pain. So what we're wanting to do is target conditions that have a neuropathic or nerve component, such as neuropathic foot pain, nerve entrapments, complex regional pain syndrome or CRPS. And so therefore you want to consider conditions specifically, such as a heel pain syndrome, which is more than plantar fasciitis and typically incorporates aspects of tarsal tunnel syndrome or tibial nerve entrapment, calcaneal nerve entrapments, and broad chemically mediated peripheral sensitization. Now this works so incredibly well in these cases, but also, consider those superficial perineal, over the top of the foot, that sural on the outside or lateral side of the foot, and even the Joplin's or Morton's neuroma, Joplin's around that big toe joint and the Morton's neuroma through the forefoot. Now, similarly in chronic musculoskeletal pain, we find that it's really effective. Now this could be for our heel pain syndromes again, with a bit more of a plantar fascial aspect, but particularly where there is radiation of pain, but then also tendinopathies. And I say that the Lyftogt Prolotherapy mixed with my laser therapy, taping, and the standard of eccentric strengthening, our heel raises, is the missing ingredient that has helped me heal a lot more Achilles tendinopathies since I've been using it. I now really push my patients to start considering this as a really appropriate option that will decrease their pain, potentially from that initial visit. Now, they are stubborn, and so I do make sure that we do look at different options, but more often I am looking at a Lyftogt Prolotherapy as an initial option when it comes particularly to Achilles tendinopathy. But let's not forget any other type of tendinopathies. Another one that I find is fantastic here is extensor hallucis tendinopathy. But also don't forget your arthropathies and arthritis. So I'm talking about ankle joint arthritis, tarsometatarsal joint arthritis through the midfoot, but also the big toe joint, that first MTPJ. Now, our other side is our sports injuries. Athletes with ligament and tendon injuries, as well as repetitive strain injuries, can benefit from Lyftogt Prolotherapy to really expedite or accelerate that healing and get patients and yourselves back into sport quicker. Now, I find this to be incredibly effective, particularly in tibialis posterior insertional tendinopathy, but also calf strains, where you may be doing it, after a meet on that Monday, Tuesday, undertaking an injection on when you see them on that Monday, Tuesday, and then, by that Wednesday, Thursday, they're back 100%, doing some of their pre-event sort of exercise again, and building back up to have no concerns during their next weekend meet. Now, of course, resistant cases is a pretty straightforward one here. These are the patients that you've thrown everything at. They've failed to respond to all conventional and conservative treatments, and that might include physical therapies and exercises, medications, or even a corticosteroid injection. Now, we have nothing to lose at this stage, but the Lyftogt Prolotherapy can really reduce some pain and get the patient back into life and moving again. Now, we may be able to start pushing them into the right direction, along with our biopsychosocial approach to pain management, which really needs to be considered in these more chronic and resistant cases. And there's definitely some other videos that you can have a bit of a look at with regards to that. But for the moment, this has been the indications, as I mentioned, what we do treat with Lyftogt Prolotherapy. Cheers.